a lot of what I do is the sexual history that 90 some odd percent of people in the world that go to practitioners will never broach the situation of, hey, are you happy sexually? Do you want to engage in other things that you're not?
All right, everyone, it is interview time, and we are here with Dr. Goldstein or Steen. Uh-oh.
Goldstein.
Steen. I did it right. Yes, except not right because I added both. So, Dr. Goldstein, author of But Seriously, and seriously, there are two T's in that but. The definitive guide to anal health, pleasure, and everything in between. If you are an avid shameless sex listener, you know that some of our favorite topics are anything anal and anal August. It's popping around these parts, but it is January when we're recording, and this will probably come out in January. And we are always excited for butt stuff. But seriously, though, are you all ready? Yep. Okay, I can't hear you, but I think you are. So you already heard a little bit about the doctor in the intro in the bio. But dearest butt doctor, can you please tell us a little bit more about how you got to where you are today in the field of sexuality?
Yeah, sure. So I actually came out later in life. I was married to a woman for several years. I was studying heart surgery and I was fucking miserable and I hated it. And I came out, I met my partner, Andy. We've been together 18 years. We have 2 kids together that are almost 13. And as I was coming out, I was kind of realizing that I was not happy at all in what I was doing. But then I started to realize, okay, I'm going to leave heart surgery. What am I going to do? And so when you started to kind of analyze who I was like, wait a second. What happens if people don't know how to engage anally? Who do they go see? I said, what happens if someone gets hurt, especially in the gay community, let alone the entire anal community? Where do they go? And so I started kind of asking all these questions and realized that people didn't have the resources. And this is now 15 years because I've been doing Bespoke Surgical for 15 years now. And I said, I remember even saying to Andy, I'm like, I think people need this. I think that communities need this. And like, where do they go? And he's like, oh, who gives a shit? Like, they'll just go to a proctologist. And I was like, yeah, but that proctologist doesn't exist, especially someone that doesn't stereotype, that doesn't have stigma or taboos associated with anything that we're doing. How do we kind of destigmatize sex? And I said, you know what? I'm going to do it. And that was really the birth of Bespoke Surgical. But when you're training, nobody teaches you, well, how does it heal for sex? And if you're doing surgery, how do you get people to take whatever they want? People come to me for fists, huge toys, right? Big, wide dicks, whatever it is. I need to now understand where people are and where they want to go sexually. And then I basically need to tailor a whole that supports that. And so that has taken me through many iterations of my existence, which is, been such an amazing ride to provide positive sex for people, get people back to where they need to be, without stigma, without taboo. And then that has spawned off many different things, obviously, But Seriously, which is a book that I just wrote in July that really has encompassed all 15 years of my practice into a book to really reach globally so people can get to their anal desires that they want.
When people think anal desires, because anal itself, when you're describing someone as anal, like, oh, you're like, what, you're like anal retentive, whatever that is. It's like such a like negative, hyper focused thing. But when people say that, I'm like, yeah, the ass should be hyper focused. It's the ass. Everyone, like, it's a compliment. And this wasn't on my list of questions, but you already touched on this, and I'm curious. So, a proctologist is someone that specializes just in the health aspects and not the pleasure aspects of anything anal. Is that right?
So in theory, they should really be doing everything, but it's usually a typical hetero white guy, older, that just has not been educated on the sexual understanding. So when you look at like what their definition of success is, it's probably related to, are you shitting?
Oh,
it's
yeah,
not.
Exactly.
And most people don't get asked simple questions of like, hey, do you engage anally sexually? Do you want to engage sexually? What type of sex do you engage with? Is it painful? Is there bleeding? And kind of a lot of what I do is the sexual history that 90 some odd percent of people in the world that go to practitioners will never broach the situation of, hey, are you happy sexually? Do you want to engage in other things that you're not? How's your primary relationship, your secondaries, or what are the kind of dynamics of your sexual life? And those conversations guide so much of what I need to do on the surgical side or the medical or the optimizing side, that it's so important. I think newer generations of all doctors are getting a little bit more educated in terms of how to have these discussions. But the reality is that we still have a huge, long way to go.
And this also was not on my list of questions, but I'm so curious. So how did you, other than like your everyday, well, maybe that's part of it, right? Your everyday life and your experiential experience of all things anal. But how were you trained? So you're a doctor, you have that medical side that all these people you're talking about who don't necessarily have the training to bring in the more like, well, but what about all the other aspects of your life, including the pleasure parts? How did you seek out that training or get that experience?
Totally trial and error on my side. Because, when you start to see 90 patients a week, I do about 90 patients a week in the office. I do about 15 surgeries a week.
Wow.
When you start to see 90 people that engage anally or want to, you start to see patterns. You start to see how do things heal. You start to see kind of different communities, the different sexual acts that happen in different communities. And then you're able to now start to create the appropriate healing, the appropriate protocols to get people to where they need to be. So a lot of it was trial and error because nobody else was doing it. And I was the last stop. I'm still a last stop for so many people that are all over the world that have gone to surgeon, have failed medical treatment and surgical treatment. And then, or they've had surgeries that weren't done correctly for where we want them to go. And then I have to bring them to a better space. I think what helps is that I take it up the ass. I think it helps, and I talk a lot about that in the book of like my own issues of having an anal fissure during medical school and having to have surgery and then like realizing like, oh, so I would say to Andy, just stick it in my hole. And then like you realize that that's just not how anal works. And so you start to kind of be like, well, wait a second, if I'm having these issues, think about how many people in the world are having these issues. And then how do we start really just first discussing them and making it easy topics of kind of conversation. And then once you're able to do that, and it's super fun to do at a dinner party too, it just kind of cuts. Everyone's
I
like,
go to
"Oh,
that
fuck.
dinner party."
Yeah, totally." And then after, everyone's like, psh, 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 "Can I get an appointment? Can I come and see you?" Because everyone in their life has either anal issues or will, and then many people want to get to the sexual side of anal, but they just don't understand how to do that.
Well, and so with sexuality in general, there's so much shame and stigma around being vocal about it, being curious about it, understanding your own body, exploring it, all the aspects. You already know this. And then you add the ass to it. There's even more shame because it's the ass. Although to me, I'm like, it's kind of backwards because everyone has an ass. It's the universal orifice. Everyone has the potential. Most people, most, like many mosts have the potential to feel a lot of pleasure anally. Some people have prostates there, so they can feel even more in a different way. Yet it adds an even more of a level of like the taboo, right? And so you're experiencing like the double whammy of your like sexual health, people already being a little reserved, and then you add in the ass, and they're even more reserved. Also, so I used to teach anal 101 workshops in person, and I loved how people that would come were so curious for information, so afraid to ask the questions in front of the rest of the 20 people in the room, and they all had the same questions.
Totally.
Mostly about poop, honestly. Poop and pain was a big part of it. So, and I say that just with it really is like a unifying orifice or experience. Even if someone doesn't want to do anything anal for pleasure, right? They still have an ass. It's still a part of themselves that ideally need to, air quotes with need, but it's ideal to have some connection to that part of you for health purposes. So I'm just super stoked about what you are doing. And so you're saying a lot of people there's not a lot of other people out there like you. So you have people flying in from across the globe, and you are the leading anal health expert in the U.S. So what does that entail? Is that scary? Are you like one of those people that walks down the anal red carpet and you're like, everyone knows me?
I think, I wish that there was a lot of other more people in the world that would just provide the care because it's not very complicated. But I think it's, in due time, there will be more because it's a lot, when not, you're the only person and people are constantly coming and it's like, 24 hours a day, 7 days a week, emails from all over the world and people, it becomes a lot. But when you see what you do for people, by doing something so small, what I think is so small on a surgical perspective, but has exponential ramifications of improving their sex life. I mean, it gets me up at 5 a.m. every morning to come in and do what I do because of that. I think when you look at, you're right, there's so many taboos and stigmas associated. It's not only in the United States, it's globally, it's through religion, it's through so many societies and pressures. But I think when you look at all of those and break those down, the reality is that there is so much pleasure. And it doesn't even need to be penetrative pleasure, right? We know that there is so much positive nerve endings all over our body, necks, underarms, boobs, nipples, ass, all that stuff. And so with that being said, for people to understand that that can enhance their sexual world is so important. Just the hierarching view of that. Mm-hmm. Then it's more of saying, well, wait a second, I do want to get a little bit more into penetration. And why is that so pleasurable? You made mention of the prostate. There's also an A spot, right, where women don't have the prostate, but people that are born without prostates, there's still so many nerve endings in that space. And we see a lot of translational sensations into the vaginal cavity, into the cervix, into the uterus that enhances and creates this environment that just completely exponentially improves your orgasm. So I think a lot of this is to be like, how do we just focus on sexual exploration? Forget anal first, just sexual exploration of our entire bodies, and then start to incorporate where we feel comfortable to get you into the anal groove.
Yeah.
Literally.
I wish April was here because she would say some of her best orgasms are from anal sex. And I think for a lot of people, when they think of that, it's just like the in and out thrusting that we're like, oh, you're having orgasms from that. But with what you're saying, and I know she'd agree, it's that the shape of whatever the cock or the dildo is also penetrating other areas of her body indirectly, and kind of directly, through the vaginal, the canal or the side of the wall between the rectum and the vaginal canal. There's also, I believe, clitoral tissue that goes all over the place. So,
yeah. People talk about that posterior clitoral stimulation. It's super, super common. And you're getting a lot of really positive nerve endings. And it also can change with positions, right? Mm-hmm. We know laying on your back versus doggy and kind of how you're entering, you will start to see. Now, this will lead us into a lot of what I try to do is I try to tell people that if you're thinking about getting into anal, you first need to do self-exploration. Mm-hmm. And the self-exploration is really more of what type of anatomy do you have? Anal sex is not overtly very complicated. It's muscle and it's skin. That's it. And there's 3 sets of muscles. If the listeners are squeezing your hole, doing a Kegel, you're squeezing 2 out of the 3. You're squeezing the first 2 that are there. Those are considered the external muscles. There's an internal muscle. In the male pelvis, that internal muscle is really tight, really well formed. In the female pelvis, not so much because we need for birthing to happen. All the muscles in the pelvic floor are a little bit more lax in that space. But if someone's trying to enter you or you're using a toy to get in, you're trying to get all 3 of those muscles to fully learn to relax. Mm-hmm. And it takes time to do that. So the question is, what type of muscle structure do you have? What type of skin do you have? We know the female pelvis has thinner muscle, but really thin skin. So the goal with all of this is by using toys, you can explore. I love a glass kit of toys.
Mm-hmm.
I started a company called Future Method. It's all about positive products for the space. But with that, whether you're using our glass kit, whether you're using others, I don't care. It's the concepts of how do you start to create friction by getting the skin tougher, more pliable, but by also learning how to actually relax the muscles. And it's no different like going to the gym. Most people, when you do biceps, the next day you're doing triceps to stretch the bicep. We never stretch our holes. So 99.9% of the day, our asses are in contraction mode. So if you're trying to get into anal and you're new, there's a protocol. You can find it on Bespoke Surgical, Future Method. We'll share it. It's in the Bot, Seriously book. But what it is, it's basically a 6-week protocol of using the toys, small glass toy, then always starting with the small, going into the medium and progressing over 6 weeks. And it's no different. Give me 2 sets of 10 twice a week, and you'll start to see what type of hole you have. Because many people, if you're progressing by 6 weeks, you should be able to get into better sex and really explore with others and get into really good. If you can't, then where are you in that? Is the muscle too tight? Is the skin too fragile? What are some of the issues? And we go over that extensively in the book for people that can't come and see us to know what they can do to get into good anal play.
And so when you're talking about the stretching of the hole, I just love all of this. I'm just like so excited in my body as we talk about this. Again, for the listener, we're not talking about, and this is a question for you. So this is a question. My assumption is we're not talking about creating a wide open hole that's gaping all the time.
That's
We're
right.
creating like a muscle memory experience where you're training your body, just like you would, like you said, arms, legs in the gym, to respond accordingly, or for you to have an understanding of how your body responds, so you can work together with it. Right? It's less about like, let's just stretch that thing.
Totally. Now, I think there are definitely people that want to stretch that thing to get to fists and huge toys and all this type of stuff. But run of the mill from an anal perspective, and this we talk about in the book too, is also a taboo stigma where it's like, am I going to get too loose where I'm just going to shit on the street all the time? And the reality is that no. I see, first of all, sometimes I have to cut a lot of muscle for people because they're so fucking tight. And you can cut so much and not have incontinence issues where you're leaking stool or you're having gas. So when you're talking about run-of-the-mill anal, I don't see incontinence issues if you're doing things correctly, because we're sitting all day and we're tight. We're going to the gym and we're doing squats and working. So there's a lot of time where you're actually doing a lot of muscle building and you don't even know that you're doing it anally. What we're doing is exactly that. We're saying, okay, how do we start to really learn to isolate those muscles and create that relaxation so that when we're ready for penetration, we're actually open. The best bottoms in the world bottom 2 to 3 times a week. And if they're not,
bottom meaning they're receiving
they're
something.
receiving, they're receiving something. And if they're not fully being penetrated, then they should be using a toy in the shower or before showering, just periodically to keep it. It's a use it or lose it region. And if you're not, if the people that I see a lot getting hurt, they're like 2 to 3 times a year, and they don't do anything to lead in, and they literally go from nothing to dick. And then they tear, and then they have problems.
Surprising that would be. Sorry, I'm not laughing at y'all who have experienced that, because that's most people, and I've been probably one of those people in the past. But also surprising that, like, to think that this muscle would just automatically be able to. But again, okay, not again. Let's just bring it to porn and how porn has showed people you just shove it in.
Yeah, and you can't. And I think that the nice thing for people to understand is, because of my practice, we've been able to understand that there are 3 different types of bottoms. So about a third of people in the world will be able to open their muscles regardless.
Even without practice? It's just natural.
Even without practice. Naturally, they're in a good space where they can relax and control, and they're just anally gifted.
Mhm.
Now, the other 2/3 have issues. And if we break up the 2/3, about half of people are either too tight on the muscle side or reflexively. And I say that I do a lot. I do 60% functional work and I do 40% mental work.
Mhm.
And the mental work is not only, oh, is this going to feel good and mentally in it? It's the neural connection also. Like, if I'm squeezing my ass, am I actually squeezing it? And if I'm relaxing my ass, am I actually relaxing it? So that other half of that 2/3, those people are really more of like, if I educate them, if I show them the right way to use toys and stretch, most of those people can learn how to enjoy anal without having to do something medical or surgical. And then the other half is anal Botox, which I'm sure we'll talk about because it's a huge thing in my practice. Surgery, sometimes I have to cut the muscle, or if there's extra skin or a hemorrhoid or a tear that just didn't heal correctly, it creates friction and I need to do something surgically to set the stage for success. So by using the toys, you're now kind of, well, what type of bottom are you? And by doing that, you're able to now say, am I in group 1, 2, or 3? And then you're able to be like, look, if I'm in group 3, most of those people need a surgical approach or something in the office with physical therapy, anal Botox to relax those muscles. Remember, it's just a rubber band, right?
Mhm.
Think of an accordion, right? It just opens and it closes. And the question is, where are you? Are you going to be able to open to receive what you want, or are you not? Because if you only get 50% open, right, what happens? You're going to force it. And
Mhm.
then when you force, what happens? The pressure goes up, the skin tears, you get irritated, it spasms, you feel pain, there's bleeding. There's so much limitations that can happen. So I hope that people that are listening get an understanding of like, okay, if I want to go engage in anal, this is what I need to do to start getting myself into a healthy bottoming space, and then figuring out kind of like the appropriate algorithms to get there. Or if I can't get there, what do I need to do to achieve that success? Because if you do that from the beginning, you're just going to set the stage for longevity of this. We want
Mhm.
not only shameless sex, we want forever
Mhm.
anal sex, right?
Yeah.
And for the longevity of our lifespan, how do we do that safely and correctly?
Yeah. And my brain is going to some, because we have a lot of listeners that are in heterosexual relationships,
Yeah.
and folks who would say, and I'm probably mostly women who are like, I had that one experience where it didn't feel good. Why would anyone want to do that? So they're listening to this and they're like, why would I want to like make it so that I can have this like this prolonged whatever? It never felt good. And to those people, I would suggest listening to many of our anal episodes. We have a lot of them, and we're not trying to convince anyone to have anal at all. We are just trying to expose the many ways that you can have pleasure. And the understanding really is that if the body is not prepared, relaxed, feeling safe enough, warmed up enough, there's so many reasons why it won't feel good. And there is a distinction between pain and discomfort, right? Discomfort is normal when, like, bring the gym analogy, right? If I'm in the gym and I'm working a muscle that has not been worked, it can feel really uncomfortable. But if it feels painful, we might have a problem. Hence why coming to the anal thing, we don't recommend numbing stuff because you want to feel if
Yeah.
it's a problem. So for you to understand the difference between the two of those, and so we're speaking to adding anal play to the menu in your sexual world, or maybe that of your partner or both, just adds more things to the menu of fun ways to experience pleasure, orgasm, etc. And so, I like the direction you're taking is so new, and I'm very excited about this because I do not know anything about anal Botox.
Yeah.
So this is the one of the 1/3 of people who have a hard time experiencing anal pleasure, relaxing into it, etc. And I think you already named some of the reasons. Is probably trauma experiences they've had. Also, you said hemorrhoids. But what are some of the other reasons why that might be the case for someone's body
Yeah.
to naturally do that?
Yeah. So, I mean, first of all, I think when people have, first of all, you shouldn't have pain during anything anal, right? If you're having pain, we're not doing something correctly. Like you said before, there may be some discomfort. And as you're initiating, you're going from a small toy to a bigger toy. The first times that you're doing it, you may feel some discomfort. But if you're having pain, stop. That's number one. And two is like, if you had pain, it's probably because we're not at all educated on the right ways to prepare. And think about how many people, if they just stopped when and they never had anal sex again, how many people would be missing such enjoyable experiences that I would say if it's something that you're thinking about and you're doing things correctly, pain shouldn't even enter it. It should all be on a pleasure side. Now, with that being said, I think a couple of things. When I look at it, it's always more of, well, what is the pain coming from? Is it that you're tearing the skin? So it's interesting. I see a lot of females that the skin is so thin in that space. Also, male to female. So people that are transitioning, that are using hormones, estrogen, spironolactones, they have beautiful faces and great new, beautiful female skin. But they also have anal tears, very common, because they basically have a male-born pelvis, which is really tough muscle, now with really thin skin. So I only say that because what it does is it allows you guys to kind of understand that, like, okay, I have skin, I have muscle, I have functional dynamic and how it works. And all of those things play into it. Now, most people don't even teach us how to poop correctly.
I know.
So what
That's
happens
such a
is
missing conversation.
totally. So like even shitting and wiping and like all of these things, what can happen is many people, and we don't eat correctly, especially when we're in college and we're studying and shit. It's just crap. So many people come to me where they have an anal fissure, which is a tear that has been chronic for a long time, or they have extra skin that developed from an old tear or hemorrhoid. And so now I have muscle that's too tight. I have skin that's too loose in terms of, too thin in that space. And now I have something that's creating even more friction, right? Mm-hmm. So with that being said, it's all about pressure. Think about a pipe, right? That's what we need. If there's something that's restricting, meaning the muscle's too tight, the skin's too thin, there's extra tissue, there's extra scar, all of it, you're not using enough lube, people are spit, the dick is huge and you're a smaller pelvis or a smaller person. Like all of these things create more pressure. Once the pressure now is elevated to that degree, the disparity leads us down the path of pain, bleeding, and complications, right? And so a lot of that, and especially females post-pregnancy, a lot of people have hemorrhoids or extra tissue in that space. And forget anal, they don't even feel comfy sexually vaginally because there's extra skin hanging in the space that they feel aesthetically just fucks with their psyche. The reality is I do a lot of work post-pregnancy, one, to get rid of the extra tissue so people feel sexy and comfortable and ready to engage in anything, but then also trying to kind of get them into the anal space because many people want to explore. And more people, whenever I see people, I'm always like, you know, are you into anal or are you not? They're like, and like, if I were to get your ass not painful and having fun and into it, would you engage anally? They're like, yes, totally. I would bring it into the play. So a lot of this is really kind of, which I love what you're doing, which is to really educate the masses to just be like, wait a second, let's have the conversation. Let's learn about our anatomy. Let's set the stage for success. And then if something doesn't go right, where do people go and how do people seek the care that they need to get there? Because we only have one life and one asshole. And the reality is that, you know, you got to use it and we got to bring it into the sex space because especially on the male side, I mean, you know, like the heteronormative world on the male side is like, get the fuck out of my ass. Don't
Exit
even come
only,
near it.
Exit only.
Yeah. And then the second they ever have a real prostate orgasm and they fucking shoot across the wall, across the room because they've never
like, what have I been missing?
Yeah, totally. So it's kind of like, how do we start to kind of really dissect all of these taboos and stigmas and really start injecting cool conversations so people can start to experience it?
Yeah. And it just adds more options to the menu. I've been in relationships with people who, anal, meaning like them stimulating me anally was off the table. And it wasn't like a deal breaker, but I felt like the menu is a little short-handed, a little short-sighted. Like, you know, but that's just me because I'm someone that has been into anal things in since my late teens. And for some people, it might not be their jam, but I just think that when you take a whole orifice off the table, Yeah, that's your right. And if you are someone that wants an expansive menu, and that's been the case where it's been not been on the table. Maybe there's more things that you can learn, and also there's ways that you can work with some of the traumatic experiences that you've had, which are very common when it comes to anal. Also, let's just talk about you. So lube with anal, very important, very very important. And sometimes with a lot of lube, you get a little slippy, goes in the wrong hole, meaning in the ass, and it feels like someone kicked you in the stomach. And I think a lot of people leave with that's how anal is if they've never experienced it. And I've experienced pleasurable anal and the stomach kick of it slipping in the wrong hole anal. And I can tell you they're very different. And the latter is not how pleasurable anal goes. But at least it's a good sign that you had a lot of lube. So that's nice. So anal Botox? Because my understanding Botox is it kind of freezes the muscles, and then so my brain's like, so if it freezes them, like, can your muscles still open and like open and then close for pooping, or how does that work?
Yeah. So a couple of things from an anal perspective, just with lube, I'm a huge fan of silicone. Silicone-based lube is still the best from an anal. I get it. It fucks with the sheets. It's a little bit longer to get off from a shower perspective.
The way to get it out of your sheets, Dawn dish soap. Not sponsored by Dawn dish soap, everyone, but it gets silicone lube and oils out of your sheets and clothes. I don't know why. Anyways.
That's awesome. But I think especially with glass toys, and I like glass because you need pressure. Silicone based, a lot of the toys are really more flexible and soft, but we need to engage the muscles. And so glass picks up lube the best. It's super easy to clean. And I think silicone based lube is the way to roll. With that being said, spit, no. And then like you said before, obviously numbing stuff. If you're using numbing creams, if you're using numbing lubes or poppers, which is huge in the gay community to relax the muscles, the key is you lose the sensation of actually feeling pain. So that's why, again, you're right. Like that should be off the table. I do a lot of anal Botox work for people that use poppers or that are using those creams and lotions and lubes, because what anal Botox does is it achieves the same thing, which is it basically tries to get you relaxed. Now, there are 3 sets of muscles, like we said before, in everybody's ass. If you squeeze your ass right now, you're squeezing the outside 2. The third one is the one that you and I don't control. That's the one where you give anal Botox. So you're still able to
inside. You're going inside the rectum.
Yeah, exactly. You're going into the anal canal. It's about 3 to 5 centimeters inside is where that third muscle is. And that's a muscle where, like, let's say I was trying to enter you and you're like, I'm relaxed. And I'm like, I can't get inside.
You're not relaxed. Yeah.
you're like, I feel relaxed. Well, that third muscle doesn't really listen to you. So that's the one where that group we said that relaxes quite well, they're able to control that third muscle. The other 2 groups can't. So that's where dilating, you can learn how to do it by stretching and using toys. The other is anal Botox. So anal Botox, it lasts for about 3 to 4 months. I do it in the office. It's easy to do. It's about 4 injections. Yes, it's a stick in your ass and it's annoying, but it's quick. But what it does is it basically decreases the pressure by about 15 millimeters of mercury. So what does that do? Well, we know in the office, we do anal manometry, which is, remember how we were saying, how do you use the toys to understand what type of hole you have? Well, in the office, if you came in to see us, we actually can do a test that will tell us, because we're able to measure the pressures. And by doing that, I'm able to know not only are you a Botox candidate, but what dosing do I need to do to get you to decrease to the right amount? If you think of people that are too loose, normal, and too tight, we're just bringing you down into a normal range. And most people don't need it forever. Most people do anal Botox, maybe 2 to 3 sessions. It lasts for about 3 to 4 months. And the theory is, if I give you something to relax the muscle a little bit, now you can actually use the dilators and have sex to stretch the muscle into the normal range correctly.
So it kind of sets you up to be able to do the lateral work. Got it. Okay.
Exactly. And then when the Botox wears off, now the muscles are in a good space. You're able to
Oh,
now fully relax.
so it's
So
kind of
most
like
people
not, it
don't
could be
need
like
it.
a one-time thing or
Yeah, I would
experience.
say most people about 2 to 3 sessions.
Okay,
And
so
then I
it's a
think a
yeah,
lot of people just love it because
yeah.
it just makes you like a complete power bottom in a good way, right?
Power
And by
bottom.
and by decreasing that pressure, it's all pressure, right? Injury happens because of pressure. If
Mhm.
we decrease the pressure and get your dynamics to work, now you're just having so much better sex that it
Yeah.
just sets the stage for that success.
That's awesome. I had no, I love learning about the like modern day medical technology that we have. And I think also for our listeners, when we talk about these kind of things like Botox or we've talked about Scrotox before, we're not saying again that there's a better way or that you have to be able to, you have to do this. It's just like understanding the many options that are available. And like with what you're saying, dear doctor, you're saying that there are some people where they want to have anal sex, but there is a limitation in their body. And so you have the ability to help them with that. And another reason why I feel very excited about that is because it's not just like, oh, I put Botox in the third muscle in your ass and then you're good to go. There's homework after that. It's learning about your body. And any good practice doesn't just have the little blue pill. I know Viagra, I'm just referring to that, but isn't just that thing. There's more, there's homework. There's like, how do you bring this into your everyday life so that you need less of the little blue pill or you can use that little blue pill to get you even into higher results. So I love everything that you are sharing. And I want to learn more about the future method in a second, but you're down to play a game with me. It's a rapid fire game.
Yeah, let's do it.
I hate rapid fire, but I love doing it with people. So this is three different prompts. This is hot or not, but because we have the doctor here, we're going to add hot or not and healthy or problematic. You can answer it with your own personal opinion and also share your knowledge if you like. Okay, hot or not plus healthy or problematic. Anal cream pies.
Oh, hot.
Hot. All right. All right.
Hot.
Problematic and
Hot.
healthy.
I think that again, it depends on what you're kind of really looking at. Obviously, when you think of excess mucus and excess liquid in
We're
that
talking about jizz in
space,
the ass, everyone. Jizz in the
yeah, yeah.
ass.
So a couple of things. I think again, that's obviously where people can get STDs. So when you look at just from an overarching component, right? Safer sex is better. The gay community, most people don't use condoms, about 80, 90%. So we do a lot with doxypep, which is an antibiotic that people take the day after or 2 days after to mitigate risk.
Mhm.
It's super fucking hot.
Mhm.
I think the key is looking at if you are receiving that, how are you douching? Are you douching with the right solutions? How are you making sure that you're doing less irritation in the space, making sure that you're being conscious of getting tested routinely and setting the stage for that success. So I'm always someone that meets someone where they are. If you
Mhm.
are someone that thinks that that is hot, great. How are we going to just reduce the risk so that you or anybody that's coming in your ass then and or to follow allows for it to be a safe space? But I think
You
it's hot.
you might have my favorite answer out of anyone for this one. So for me personally, I think it's hot. Like when I watch it in porn, I have an ass that just like absorbs all of the cum and it doesn't come out, and then I get a stomach ache. Doctor, is
Yeah,
there something wrong
yeah.
with me?
No, it can happen. I mean, even if you give a blowjob and you swallow
Yeah.
cum, there must be something in that
Yeah.
just kind of creates a
It's
dynamic.
probably like the shape of whatever's happened of my unique ass. Like April's like, I love jizz in my ass. It's great. I don't have that same thing where I'm like, oh, I have a stomach ache that ruined the whole night.
Some people do douching after,
Uh-huh.
to kind of set the stage and get rid at
Yeah,
that perspective. But
that's probably what I need.
everybody's got a different haul.
And everyone, I'd say also just for when you're putting fluids in your ass, hydrate yourself because otherwise your body's going to try to absorb it because your body is
So,
really smart. Okay,
totally.
what about this one? I feel like I know the answer for you, but I'm going to ask it. Hot or not, plus healthy or problematic ribbing?
Oh, super hot. Can be problematic. I think rimming is super hot, and it just is a gateway to people's soul. Honestly, I
It
think if it's done correctly, you will just. I mean, it's just people go fucking nuts.
is.
We need to break down the stereotypes for you heterosexual men, mostly, but. With that being said, a couple things that I see with rimming. One, herpes outbreaks, and it's a lot of herpes
Mm.
type 1. We all have, a lot of us get cold sores. So if we're licking down there, just remember it could be a real thing. Also, us guys that have stubble, when we're down
Oh.
there, the stubble can create friction. So people shave, then you have stubble, then you're going to town, and then obviously all the saliva in that space. So you just got to really be cognizant because you can get bacterial infections, you can get fungal infections. So if you are, make sure you're doing good work before of like soap and water and keeping it clean. And then also the same thing post sex. I think post sex showers are so important,
Mhm.
and really making sure that you dry the area, be naked, let it breathe, hair blow back there, nighttime showers, things like that, because that area creates moisture in and of itself, especially vaginally, right?
Mhm.
Because of the moisture in that space. So how do you kind of counteract that? But super hot.
Yeah. Yeah, I like what you said also about the stubble part because, and this applies to pussies, right? Like you have something brushing up against and maybe creating tiny fissures, then you're more
Totally.
likely to get some sort of infection or even an STI or something like that. So,
And even I see sometimes HPV, anal warts or genital warts
yeah.
from licking and irritation.
Yeah.
Wet wipe use, I hate it.
Oh, really?
The current wet wipes that are out right now, I only see complications from.
Is it
I
because the
know the listeners hate.
ingredients?
I think it's three things. I think it's the fabric they're using. I think
Uh-huh.
it's the ingredients, and more so, maybe even the moisture. So what a lot of people do is
Interesting.
they use it, they pull your underwear up and then go, right? Because you shit
Yeah.
and go.
And now it's all
But
wet and yeah.
totally. And I see so many complications from it. So if you have an itchy hole,
Uh-huh.
or you feel as if like there's these micro tears or this cracking in the space, things like that, and you're using wet wipes, that's what it's fucking from. You got to just stop that shit.
Interesting. So is there like another thing that they should use if they want to like get the super clean
I think
bidet?
bidets are super easy. It's super
Yeah.
cheap and easy. Just go in there. If it's that bad, pop into the shower, soap and water,
Yeah.
that type of thing.
Okay. Yeah. I know someone who at Burning Man, porta potties, and they brought their own little anal douche thing into the porta potty. And because they're like, I'm going to clean my ass in here because there's like
Yeah.
no sinks or showers or anything.
Yeah.
And they dropped it in the porta potty and
Oh,
they're like, should I fish it out? Luckily they didn't. I was not
no,
in the porta potty with
no.
them, but later they're like, I thought about fishing. I'm like, thank God you didn't. Okay. Yeah.
Next time they'll attach it to like a
Yeah. Yeah.
bracelet, like a
Wrist,
boogie board or something, like
exactly.
a
Like,
surfboard.
yeah, yeah, it has a little cord on it, so you're like you don't lose your douche down there. All right, last rapid fire: hot or not, plus healthy or problematic. Ass to mouth.
Ass to mouth. Oh, in terms of like shitting, you mean?
Well, like you
Or
fuck the
just in
ass, and now you put the cock or dildo in the mouth.
so you fuck the
Ooh.
ass and then yeah, that's not hot for me, but there's definitely people that find it hot
Uh-huh.
in that space. But clearly, there's so much bacteria anally, even if
Yeah.
you're doing the right elements from a douching perspective, that I wouldn't. And it's the same thing you talk about, like, why females wipe front to back,
Yeah.
right? We don't want any cross contamination from that space. But I will say, if you are into that,
Hmm.
gurgling Listerine for 30 seconds post any blowjob sex, licking, analingus, this will, in theory, mitigate STD risk or specifically bacterial or other issues. So there's things out there. Again, the doxypep, using an antibiotic. Some people love to lick ass, and then I see them and they keep getting giardia or parasites.
Hmm.
So we use Flagyl, which is an antibiotic. When they're in their kind of full-fledged licking zone, I give it to them to mitigate that risk. So again, I think what's so cool about what we do at Bespoke Surgical and everything is like, I'll meet you where you are. People have kinks. Like, that's great. Like, you should. Like, what are those? And how do we get you to do those the healthiest
Hmm.
for you and the community? Because at the end of the day, it's not only your ass, right? It's like every dick, every face, anyone that comes into contact with you, it just goes community based wise. So it's kind of like It's super fun stuff. I mean, I
Yeah.
could talk about it forever. I don't
I
care.
know we are when April's back, we are going to have you on the show again because I'm gonna rub in her face like you missed this episode and it was really fun. She'll listen to it. April, I love you. Okay, so yeah, and I love what you said about the ass to mouth thing and the gargling. That is a really good hack. I've sworn by it's not for licking ass, but I use food grade hydrogen peroxide every morning, and I have yet to have COVID. Don't test me, everyone, but I'm pretty sure. But if I go to places like, especially if I go to like a sex party or something, I am gargling with that right after, and I'm pretty sure it has helped me it to stay healthy. And so I like what you said.
Similar concept. It
Yeah,
must kind of just clear out the cellular work that's
yeah,
causing problems. Yeah.
exactly. And it's easy. And they're like, then I just licked some ass, and it was great. Okay, so before we wrap up, can you tell us more about the future method that you've
Yeah.
created, and then maybe like elaborate? I think we heard a lot about your book, but maybe a little bit more about the book. I think it's for anyone that's into anal, right?
Yeah, totally. Yeah. And even for people that are engaging and or topping and kind of engaging that way. So what I kept seeing in the office was a lot of people were coming to the office with ailments that were a lot from the products that they were using. So people douche and clean out. I get it. And they use water. So I would start to see people coming to me with a lot of STDs. And I'm like, well, wait a second. Is it the douching? And then I started to do research and you see that the douching causes so many problems for people anally. And why is it? Well, they're using water or they're using enemas. And what winds up happening is that it basically kills the cells in the rectum. So it produces a lot more mucus. There's a lot of irritation and people don't sense it because they don't have pain receptors in the rectum. They only feel fullness or you get a stomach ache like you did, we're talking about. With that being said, I said, wait a second, why doesn't something exist that you can clean that makes you feel sexy and silky, but doesn't fuck up the microbiome and create an increased risk? So that was the birth of Future Method. I said, well, wait a second, I'll create it. So I raised money, raised capital with people that were so sex positive and really working with amazing people all over the globe that allowed us to now come up with a powder pack that you put into whatever drinkable water, whatever 4 ounces. If you put a powder pack in there, it neutralizes it. It makes it pH balanced. It makes it what's called isotonic and isoosmolar, and it doesn't fuck with the microbiome. And then you start going down many different layers of being like, well, why do people need to douche? Well, because they're not having the appropriate fiber. So I said, okay, let's create the best fiber for bottoms. So we created a fiber. Then I said, okay, well, if we're changing the microbiome, why don't we replace the microbiome? They're like, no, you can't do it. I'm like, fuck it, we can do it. We did it. So then we came up with the first ever anal specific, vaginal specific, kind of peritoneal specific, that specific microbiome.
You take it orally, or
you take it orally.
You do, okay.
Orally, and it goes all the way down, and it replenishes basically the sexual microbiome. So when you look at all those things, then we came up with an appropriate lube, and then I came up with toys because I was like, fuck, there's no toys that I think are appropriate. And so it was really bringing science into sex and thinking differently. And then it started to really catch on where we have great partnerships with so many amazing companies, but even people that like, you would be like, fuck, I can't believe that they haven't been in the anal space. Now they're finally seeing that like, wait a second, this is not only for anal. This should be for everything, which is how do we make sure that the lubes are better, right? We know water-based lubes are just like water for enemas. They're really, they dry you out. They cause microbiome changes, yeast infections, problems. So I look at sex so differently where that's what Future Method is. And I break it up to kind of what do people do before sex? How do people engage and play? And then what's the aftercare? And so a lot of all the products fit into those categories, which allows people to think differently about sex. People do so much work on their face with facials and creams and lotions, but we never do it for our sexual organs. And it's the same. You're going to see more and more and more for all of this, which is to say, okay, how do I make sure that I'm doing the right things anally? From shitting and wiping and using to hygiene, to fiber and probiotics, to better douching and lubes, and then understanding, and then the aftercare of like, What if I get injured? What
Mhm.
creams do I use? What suppositories? How do I know when I need to see a physician? So that was really the birth of Future Method. And that leads into But Seriously, which was how do I just teach people everything? Not only, anyone that has an asshole, but even practitioners and people that aren't engaging anally but want to, or people that are, and how do we get them to better their game? People that want to go into fisting and understand. So I break the book down into kind of like the taboos and stigmas that exist. And I also talk about my own stories, which allows people to relate, and then really goes deep into anal anatomy and people understanding what type of bottoms people are. And then also I give a lot of top tips. So if you aren't receiving anally, but you're giving, well, how do you do it correctly? How do you understand the anatomy? How do you understand how to lubricate? What are the right positions? We grade by peaches, 1 peach, 2 peach, 3 peaches, for different positions and more experience from beginner to intermediate to advanced. Lots of things can go wrong anally. And especially a lot of people want to be submissive as a receiver, which I get. But when you give away your rights in that space, right? Obviously it's consensual, but when you give away, you're now hoping that that top knows what the fuck they're doing.
Mhm.
And so I try to empower bottoms to be submissive, but still be in control.
Mhm.
How do you create that dynamic? And then it goes over like, well, what if things go wrong? And how do I seek help? And what are the things that I could do to prevent chronic issues? And what surgeries do we need to do? And how do we communicate sex? So a lot of this is like all full circle, which is
Mhm.
like the surgical practice to product centered work to now educating the masses so that you don't need to see me in the office
Mhm.
from an injury perspective because you've done all the right things and you're successful with what you're doing.
Yeah, so it's a like a holistic approach, and something where people might be able to just utilize that book and not, like you said, not have to see you. And if they need or want to see you, then they can do that too. And I absolutely love that, everyone. But seriously, y'all know how to spell butt, right? Butt. But seriously, go and get the book. Go check out the Future Method. I love everything that you've shared on here, and we are so having you back. I'm not just saying that. I'm so
Oh,
excited for this because I feel like there's so much more we could talk about. And I just want to leave everyone with a final note, which is very much related to what you just said. If you're going to penetrate someone's ass or you're interested in it, maybe check out your own ass to know what it feels like. And I know you shared this before that you think everyone should check out their own ass to understand anal play, but I think that the tops are forgetting to do that. And it is a very insightful experience to understand your muscles and the way it works, and also know that the other muscles and other people that you're playing with will be different from yours, but it'll give you a little bit of information. And go and get products from the Future Method. But seriously, go get some really good lube and go and enjoy your universal orifice safely and with love and lots of pleasure. So, okay, let me see if I know how to wrap this up. All right, everyone, but seriously, if you have not reviewed us on iTunes or Spotify, but seriously should go and do so. We love 5 stars. It helps people find us. Helps people find people like the amazing doctors and educators and therapists and authors that we have on the show. And we really appreciate it. And we will see you next Tuesday, as we always do, because we haven't missed a Tuesday since 2017. And we love you. Ciao for now.